Paul Bauer.
Yes. Hi, I'm Paul Bauer. Nice to meet
Hi,
you.
I'm Tanya Bauer. I'm the assistant or the nurse manager of the outpatient unit.
Oh, it's nice to meet you. How
Nice
you
to
doing
meet
today?
you. I'm doing pretty good. How are you?
Oh, pretty good.
So I read over your resume, and it looks like you have worked in the inpatient pediatric hem-onc department for about 10 years
Yes, ma'am.
in Ohio, but you just recently relocated to Louisville, Kentucky.
Yes, ma'am.
Okay, so the position that you're interviewing for today is for outpatient pediatric hematology oncology,
Yes.
and the hours are 7:30 to 4,
Yes.
4 days a week.
Yep.
And
Sounds good.
yeah. So I just wanted to tell you a little bit about our unit. It's an outpatient infusion area, and I know that your specialty is pediatric hematology oncology, and about 80% of our population is pediatric hematology oncology, but the other 20% is other service lines.
Okay.
So do you have any experience with other areas?
I've done a little bit of that, but my specialty's been with what I've been doing now. But I'd probably, since the last time I did it, I'd probably have to catch up on the latest changes to it. But I'm a pretty good learner, so I could get up to speed on it pretty quick.
Good. So we have 11 beds, and your typical day would be mainly just infusion patients. We do some growth hormone testing. That would require just putting an IV in and drawing labs on a patient frequently to monitor.
Yeah.
Most of our patients have central lines, but about 25% of our patients we will have to put a peripheral IV in and give their infusion that way.
Okay.
So, and I'm sure working in a pediatric hematology oncology floor, you have experience with central lines and stuff.
Yeah.
So we have about 10 nurses that work on our unit, and some of the nurses work 12-hour shifts, and some of the nurses work 8-hour shifts. So the position that you're interviewing for is for 8 hours, but there may be times where you might be required to stay till 7. How would that work with your schedule? It wouldn't be something that would happen frequently, but it might be a requirement of your job.
Well, with having a family and stuff, that's mainly why I like the 8 hours. But just my experience in the medical field has taught me that 8 hours isn't always 8 hours, and I understand that there'll be times where you'll work over. But so yes, I'm pretty flexible on that.
And then as far as our weekends go, we're closed on Sundays.
Oh,
but
great.
Saturday, everybody does a rotating Saturday.
Okay.
So with 10 nurses, you would be every 10th Saturday. And usually we're only open for emergencies, so you wouldn't have to work on Saturday all the time. It would just be on your Saturday. If a child had to be seen for an infusion, then you would have to work that Saturday.
Okay.
But they're always 8-hour shifts, and other than that, most of the time we're closed on Saturday. But just to let you know, you'll be in that rotation too
That's fine.
if it came about. So I was just going to ask you a few questions, and if you can think of any questions that you need to ask me, that would be good too.
Okay.
So the first question I want to ask is kind of in regards to teamwork.
Okay.
So tell me about a time when you had to work on a project with someone whose work style was different than your own.
Well, I'm pretty organized, and I always like to have a plan to things, but then I realize some people aren't like that. But the main goal is healthcare, and so if getting the patient the care they need, if I'm working on a team, it doesn't matter really what I want or what the other person wants, how well we're doing it my way or not at all, or my way not at all. The main focus is on getting the job done, and I'm always open to new ideas, and a lot of times what I thought was the best way, I'll watch someone else do something and say, wow, they really got that down. I never knew to do it that way. So I'm always open to that. Although when you do certain things a certain way for so long, you kind of get in the habit of doing it that way. But occasionally something will come up where you're like, well, I've been doing that 10 years and I never thought to do that, because you see someone else that might do the same thing as you, but then they've got this one little step. So I'm pretty flexible and
Good.
always open-minded.
Good. So another question I have is in regards to conflict and how you relate to conflict. So tell me about a time when you had to resolve a conflict with either a supervisor, a colleague, or a patient.
Ooh, conflict. I don't really like conflict, but real world, it happens. There's even on the best of days, there's someone not in a good mood, or some external pressure is causing some sort of conflict. But I try to isolate it. If somebody's upset or they're having conflict, you don't want it out in public. You ask the person, hey, can I speak to you for a minute? And you want to isolate it so you don't lower morale for everyone else, and hear the person's concerns. Maybe they got a personal issue, or something's bothering them, or someone at work got something they didn't, they're upset about it. But just ask them about it, hear their concerns, and if something is legitimate that you can do something about, help them out with it. And if it's maybe something not work related, then you need to remind the person, well, hey, I'm here to support you in this personal matter. However, don't let it interfere with your job, because we need to get the job done, and we'll try to help you and support you while you're going through this. But while you're here working, you need to kind of separate the two to get the work done.
Okay. So the other one, another question is more about along your goals and professional development. So describe how you set and achieve personal and professional goals.
Oh, wow. Well, I'm always wanting to better myself. So after I accomplish one goal, I'll be happy that I did that. But then after a while, you kind of settle in, and maybe you think, well, there's more I can do in life, or if I do this next step, I might be able to make more money or get the next promotion. So I'm always looking for opportunities to move up and better myself. And mainly, if I see a goal I want to accomplish, I just set forth the steps or do the research of, well, hey, I want to do this. What's it going to take for me to do it? Like when I went from my associate degree to my bachelor's degree, fine, I could have just settled for an associate degree, but I thought, I may not ever get management if I just stay with the associate, because most managers need a bachelor. So first thing I did was call the school I graduated from and said, hey, what I need to do to get my bachelor's, and they gave me the curriculum, and which was pretty simple and straightforward, but it had all the steps: take this class, then this one. And so I just basically researched, asked what I need to do to get this, and then once you find out, you just make your mind up that, hey, I'm going to do this, and step by step, day by day, and finally you'll accomplish it.
Yeah, good. Describe a time when you made a bad decision, and then what did you learn from the situation?
Bad decisions. Well, I think sometimes being a manager or just being a nurse, sometimes things happen quick, and you have to make decisions right on the spot, and you may not have all the information. You may think something's going on, when later you find out, well, this isn't really what was going on, it was this. But when it first happened, you thought, oh, this is what's happening to this patient, I need to take care of this. But then that's your judgment call from the symptoms, but then maybe a doctor will come in, and then they order labs, and then another doctor will come in and say, well, that wasn't what was going on, it was this. So sometimes we make split decisions on imperfect information based on our knowledge, and hindsight's always 20/20. And if you do make a bad decision, which I don't think anyone just says, "Hey, I'm going to make a bad decision on purpose." I think we do the best we can with the information we have, and if it's later found to be out that, well, that wasn't the best decision, looking back on it, if it was just a boneheaded move, you say, okay, yeah, I shouldn't have done that. I should have thought this, but I thought that. Just admit your mistakes. If you can repair the damage or make up for it, try to fix the problem if you can. If it's just something that happened, is a bad decision, you can't change anything, just try to learn from it where you don't ever make that again, and use that for further experience down the road.
Yeah. Okay. Okay, so with nursing, your day can be pretty busy, and you have to prioritize. So describe a time when you had to prioritize multiple demands, and how did you manage your time, and how did you manage your stress?
Well, I'm kind of a multitasker anyway, so you have to be nowadays. Working, having a family, it all kind of collides. When it comes to patient care, my workload's pretty standard. I'll have so many patients a day. Some of them are routine. Some of them may not be. Some of them might need, if you're used to treating someone at 8 o'clock this day and you've had this patient for a while, but then all of a sudden another patient comes in that needs something special because their condition is worse or more critical. You get out of your routine. You have to prioritize. Who can wait? Who's not priority right now? So I always look at the medical condition, the medical mission, and try to do the most critical ones that can't wait, or if they don't get the treatment, it could develop into something more serious. And then the more standard ones afterwards. And then as long as I've got my patients done, I worry about my workload, my charting and all that later, because I can remember what I did with patient A and patient B. The main thing is to do the care, and as long as nothing's rushing, or I have the time, just do my little plan and move from high priority to the next until I get it all done.
Sure. Okay. All right. I only have a couple more questions.
Okay.
So let's see. So what do you think are some of your greatest strengths and some of your weaknesses?
My strengths are I'm organized. I can prioritize things. I care about people. I love my job. Sometimes you have bad days, but as far as the sense of accomplishment and pride you get in helping people and getting to know people and working in a professional atmosphere, I really enjoy that. I've had other jobs, if you've read my resume, which I'm sure you have, where that wasn't always the case, but I like what I do. I like helping people, so that's a strength. Some of my weaknesses, I don't really know my weaknesses. I guess I have a few, but I tend to focus on the positive, maybe not the negative. But maybe some would be lack of self-confidence and always kind of maybe doubting myself sometimes. Like, even though I know, well, this is what you do, but sometimes I'm like, is that really what you do? And so I'm always double checking and stuff, which may be a good thing in the medical field so you don't make mistakes, but it kind of, you just want to have that confidence where, well, this is what you do, and then you go with it. But I guess I would have that.
Okay. So why do you think that you chose pediatric hematology oncology as your specialty?
Oh, I just like working with children. I have 3 children, beautiful wife. I just think if you can help a child, that's one of the best things. Helping anybody's great, but just being able to help people and seeing the kids smile and their purity and their innocence. Sometimes you deal with adult patients, and although it's warranted, they're going through pain, but they're a little bit more blunt and maybe pessimistic about situations, whereas the children,
children do seem to
they
be
can
pretty
turn
resilient.
a frown upside down despite the situation.
Yeah. Okay. Do you have any questions for me?
I just, I have a few here. Tell me about your staffing ratios, because I'm kind of used to what I have now, but I was wondering how that might switch in this position.
So with outpatient department, I make an assignment of all the nurses. I look and see who's coming in. So we base, like, our patients have a certain acuity. So the highest acuity on the infusion side would be an acuity of 3. So if they're getting an infusion, like a chemotherapy or something, they're a 3. If they're coming in for labs only, then they're a 2. So most of our patients are either a 3 or a 2. So what you would end up mainly, the most of patients you would have in your 8-hour shift would probably be 5 patients, but they're not there all at once.
Okay.
So they would be scheduled at 8. You may have a growth hormone patient, and that patient would be a 3. You start an IV, and you have to draw multiple labs. They're time labs. And then you may have a chemotherapy patient come in at 10, and then you give them some IV fluids for an hour, a chemotherapy treatment for an hour, and then maybe some IV fluids an hour post, and they go home.
Do you usually know the chemo patients coming in ahead of time, or does it just kind of show up?
You usually do, but every once in a while we get some surprises that come in. Our main surprises are our blood transfusion patients, because they go to the HEMOC clinic and they get labs, and then if their counts are low, then they'll bring them over for blood transfusion. So a lot of times we don't know about them. A lot of times those are our later patients, like for the 12-hour shift people. You may start their blood transfusion and then give report to a 12-hour shift person, and they finish it up. So, but the most patients you would ever have in a day would be 5. Unless something, went crazy and we had a whole lot. But I usually have at least 3 infusion nurses out front. And then I will make your assignments based on acuity, so you'll have kind of the same amount. And then the one with the lowest acuity will get the first admission, and then the second admission, and so on. So
I'm kind of used to that ratio, because right now I have about 4 to 5 a day.
Sure.
That's great. And the orientation, how long does that last for?
Well, you'll have like a corporate orientation if you get hired. And then after your corporate orientation, then you would be with a nurse for 6 weeks.
6 weeks.
So you'll be with a nurse for 6 weeks on the unit, following them. I try to give you the same preceptor every time.
That was one of my questions.
Sometimes,
You read my mind.
Yeah, sometimes that doesn't work out, depending on the schedule and the way it falls. But most of the time I try to get, at least limit it to 1 to 2 preceptors. So you're kind of used to them. So.
Well, that was it. I only had 3, and I was just kind of seeing that everything was kind of like what I was used to doing now. And then you answered one before I even asked it, so that's great. So.
Alrighty. Well, I tell you what, if you can think of any questions in the meantime, here's one of my cards.
Oh, okay.
And there's my number.
Okay.
And
I know I sent this to you.
Sure.
Here's another copy.
Sure,
if you want a hard copy, you probably
Do you mind if I call and check your references?
No,
and
not at all. In
stuff?
fact, I almost prefer you did.
Okay. All right. Well, it was very nice to meet you.
Yes, ma'am.
And I'll be following up with you within 2 weeks. Okay.
Thank you very much. I
Thank you
enjoyed
so
it,
much.
and I look forward to the opportunity.
Okay. All right. Thank you. Bye-bye.